Welcome, fearfully and wonderfully made human. It's me, Diana, from Through the Valley Therapy and Transform Mind Consulting and Coaching, and your host of the Holistic Counselor podcast, where faith, science, and holistic healing intersect. This show is dedicated to breaking the stigma around mental health, especially in faith communities and culturally diverse spaces. I invite not only experts in mental health, medicine, and holistic wellness, but also authors and anyone whose work aligns with the mission to bring you transformative aha moments, practical tools, and soul deep encouragement. Whether you're a professional, a seeker, or someone on your healing journey, you're welcome here. Today, I'm honored to welcome Dr. Staci Weiner. We first connected at the Palm Beach Mental Health Counselor Association networking event. And after a meaningful follow-up conversation with her and Dr. Benson Fox, who you'll remember from last week's powerful episode on faith and adulting on the autism spectrum, I knew she'd be a perfect fit for this space. I've linked that episode in the show notes in case you missed it. Dr. Weiner is a licensed clinical psychologist and certified school psychologist with nearly 2 decades of experience. She's the founder of Apple Psychological, a multidisciplinary practice in Boca Raton, Florida, and Roslyn Heights, New York. Did I say that right? Roslyn Heights?
Yes.
Roslyn.
Rosalind.
Tomato. Okay. She
Exactly.
works with children, adolescents, and adults, offering psychotherapy, group therapy, and comprehensive evaluations. Her clinical specialties include anxiety, depression, ADHD, trauma, autism spectrum disorders, and the transition to adulthood. And she also provides forensic psychological services as an expert witness with Robson Forensic Inc. So let's get into this rich, holistic conversation. Thank you, Dr. Weiner, for being on the show.
Absolutely. Thank you for having me.
Yeah. All right. So let's just start a little bit with you, right? Before we get into the meat and potatoes of what I want to talk to you about. But like, who are you? Where are you from? What do you want to share with the audience?
Yeah. So my name is Dr. Staci Weiner. I'm originally from New York, from Long Island,
Ooh.
and I lived there for most of my life. And about 5 years ago, I moved to Boca Raton, Florida. I have been in private practice for 20 years. Prior to that, I was a school psychologist in several districts in Long Island.
Okay.
And as you mentioned, I also worked for Robson Forensic and doing, I love that work as well, doing expert witness work,
Yeah.
mostly with trauma situations, but also a little bit of everything.
Okay, so I know like I'm gonna now my brain's going to like how did you get into the forensic that kind of work? Because that's intriguing, honestly.
Yeah, it's so wonderful. I love it a lot. So I always loved psychology. But when I was little, my dad always told me, "I think you're going to be an attorney," and so it's interesting that I ended up with doing this forensic work because I work with attorneys,
Yeah.
and we talk about various different cases and how people are impacted by different events. And it's just a totally different field than the private practice work that I do. So it just keeps me on my toes, and
Yeah.
I really, really enjoy it. So,
So it's
and how did it come to me? They
yeah.
came to me looking for a
Yeah,
psychologist.
that's what I was wondering. Like
Yeah,
the
and
lawyers like found out about you, and then the one lawyer talked to another. Because I did talk, like I said before I press record, that
yeah,
I saw your interview with Bruce Law Firm,
yeah,
and I shout out to them. I like them a
yeah,
lot. And
yeah, they're
honestly,
awesome.
they are breaking stigma for me. And see, we all have stigma on things because to me, lawyer, the second I hear lawyer is the second I'm like, ugh, you know.
Yeah, I actually love working with attorneys. So
Yeah, do
it's
you?
really awesome. I
Oh,
do, I
well,
do.
good. So help me break
Yeah.
see, we break stigma even with the therapist and the host of the podcast that's trying to break
Yeah, there
stigma.
you go.
Anyway, all right. So listen, you've seen kids go from the classroom to the courtroom.
Yeah.
Oh, that's brutal because I've seen them come out of the courtroom and like
Yeah.
Department of Juvenile Justice and stuff back in the day when I worked with adolescents. But what's one thing you wish family courts actually understood about neurodivergent children in high conflict divorces? Because that's something that you specialize in, correct?
Yes, yes. And I think that when we're talking about neurodivergent people, the things that are going to be good for them are the same things that are going to be good for everyone. I think that we just want to really make sure to keep those routines solid, be predictable and consistent in terms of where the child is going, what their schedule is. And the difference between a neurodivergent population and a neurotypical population is they both benefit from predictability and consistency and routine. However, kids who are not on the spectrum might be able to kind of go with the flow a little bit more, whereas kids who are neurodivergent really, really need to understand what the schedule is, what's expected of them, what they can expect in terms of their schedule. So that's what
Yeah.
I would say. Yeah.
Yeah, no, that makes a lot of sense. I mean, that's kind of human nature in a way. Like when we have boundaries, I mean, not too strict that choke us out, but when we have, and that's what I'm hearing is that with neurodivergency, they're resilient. I don't want to say they're not because I've worked with a few, but that's how they're created. It's a beautiful thing that do need that. And parents that are not, because that's what I see is like the parents not neurodivergent, right? Some are, but you see what I'm saying? It's like, so they're expecting the kids to behave the way they behave. And it's like, no, learn, understand, educate. It's not blaming the parents. It's just the more you understand and know, right? The better it's going to
Absolutely.
be, no matter if there's irreconcilable, whatever the word is. See,
Differences.
I'm not a lawyer,
Yeah.
and I don't even know if I said that word right, but with divorce and stuff like that. And so I'm sure like decades of working with this population and seeing what you've seen. And you also have the experience of two different states because I think we forget, like, even though we are the United States of America, which I love my country a lot, but we also have things that like are like, come on, people, let's get it together. Uh, but even each state, because I grew up in New York, in Queens,
Mhm.
right, until I was 12, and then
Yeah.
long story, and then I ended up in Florida, and it is two different mentalities, really,
Yeah.
right?
Yeah.
Like different laws, different everything. So, you've worked with trauma, especially sexual abuse survivors, right?
Mhm. Mhm.
So how do unresolved trauma and PTSD play into both, like divorce reactions and parenting a neurodivergent child? Like,
Yeah. Yeah.
oof.
And I think that, with neurodivergent children and also with survivors of sexual abuse or trauma, such as that, any sort of abuse situation, really it impacts our nervous system, right? It resets our nervous system. So we're not sure of when it's going to be a fight or a flight situation, and when we're safe. So if kids, let's say, who are on the spectrum, or even if there are parents who have dealt with sexual assault or
Yeah.
anything like that, and then there's a conflict either with their child or with their spouse, and even if the person's raising their voice just a little bit, they get heightened very easily, and overloaded and have the tendency to maybe shut down, or disengage, or maybe panic because they just don't know how to regulate in those situations because of the unresolved trauma in some cases.
Right.
Um, or if they're somebody who's who's neurodivergent, that also can pose a difficulty to emotional regulation and really understanding when the situation's okay. Oh, it's just my parents having a disagreement, or whether it's, oh no, the alarm bells are going off. This is an emergency. And
Right.
it's hard for them to kind of navigate through that.
So how do you help as a psychologist with that, with parents that are dealing with that, or they don't understand it completely, or never received the information. Because sometimes what happens, like maybe the medical professional said, "Oh, this is your diagnosis," right? But then
Yeah.
it doesn't come with a full understanding playbook with it. Or also, like we live in a culture like that TikTok culture where now everyone's saying there's some kind of diagnosis. I talked to Dr. Fox about that a little bit. Like
Yeah.
it is. It's like everyone's got it. Like if not, you know, like, oh, my ex is a narcissist. Well, they might really have narcissistic, the disorder, or do they have the traits, or is it just personality? Or it's the same with neurodivergence. Like when I hear like, oh, I'm on the spectrum, I'm on the spectrum, I'm on the spectrum. Like, how do you deal with that?
Yeah, and it's really, the label of it is not as important as what the person is experiencing, right? And we all have times when we're scared, when we think we're not safe, or when we think that there's a situation that we panic maybe. So it's really listening to the person, regardless of what their diagnosis is or not. Just really understanding what their experience is. And how we can help them with their coping skills and grounding themselves. So getting back, like their first instinct is going to be panic. How do we get them to first of all recognize in their body what they're experiencing physiologically? So some people, their heart is racing, or they get a stomach ache, or they start shaking or sweating. So really understanding what are these physiological symptoms? How do I recognize them? And that's the body's signal that I'm starting to react emotionally to whatever it is. And so we can change that cycle from panicking to, okay, now it's my time to use my strategies such as mindfulness or breathing, relaxation, changing my narrative, things of that nature. Also, there are certain skills like distress tolerance skills, such as like splashing your face with water or holding an ice cube or jumping in a shower. There are a lot of techniques to help us chill
Yeah,
and
no,
just
no.
de-escalate.
So that's basically like because you have quite a few therapists that work under you, right? And psychologists, is that correct?
Yes, there are some psychologists, social workers, and mental health counselors.
Okay, how many? Can I ask?
How many? I don't know how many I have now. I think eight in New York,
Uh-huh.
and one in Florida.
Okay. And so that means your team is taught how to, and this is why it's important because some people think they could do this. I mean, some people can. I'm not, I don't know everybody. So that they could think they could do this all by themselves or on their own. But this is why I think it's really important to understand to have your team or a community, especially if you come from an unhealthy, unprocessed, traumatic space. Because I know with divorce, I've seen it as working with adolescents, honestly. And it's hard because sometimes, honestly, too, I've seen parents stay that shouldn't have stayed together. Even though I'm a Christian woman that divorced that word in our sphere, I'm sure, you're a woman of faith.
Yeah, I'm Jewish,
Yeah.
and
Okay.
yeah,
So I know Dr. Fox and I had this conversation. So
exactly,
he's a,
yes,
and no matter what faith, it's just
yeah.
like we have to understand that the human condition, like I loved how you said that, like it's not about the labeling or the diagnosis, it's about the respect of the human that comes in front of you, right? Like,
Absolutely. And I think it's a very healthy way of thinking that we all have a little bit of this and a little bit of that, right? So it really connects you with the person rather than thinking, oh, they have this and they're over
right.
there and I'm over here, right? Whereas we're all human, we all experience emotions. Some experience them differently than others, and that's how we work with them. So.
Right. And the thing, I don't know in your experience, but I know in my experience, I was able to learn these things. I wasn't born knowing this. I was born having to protect myself because that's what human condition, right? Like especially if you're raised in a not healthy environment.
Hmm.
Because that's what you see the most, I am sure. If
Yeah.
you're working with court cases and everything like
Yeah.
that, you're seeing the situation where it's like a whole bunch of people that have these subconscious unhealed spaces inside of their parts
Mm.
in their brain. and they're reacting constantly because they don't know better. And I'm not excusing poor behavior, but we also, right, I think in our field, that's the point. We try to understand the behavior and how do
Yeah.
we make it better,
Yep.
right?
Absolutely. And it's a combination of course, we want to understand it. And as therapists, we do, that's our work, is to understand, right? But when you're a person in real life, in a situation, even when you understand, sometimes it's still like, hey, these things are difficult and
Yes.
challenging, and they elicit emotion. So it's that balance between like, okay, yeah, I understand where this is coming from. And also, this isn't fun and I have to deal with this. So
Right.
it's, yeah,
Yeah. So that's like the emotional dysregulation because I know what happens when the parent is the one melting down, you know? Like
yeah.
what are your best tools for parents to co-regulate during chaos, especially when the child has sensory or behavioral needs?
Yeah. So I'm a parent. As a mom, it's hard because we beat ourselves up, right? Where we say like, oh, I'm a bad parent, or my child is ruined forever now that I did this, or let's say the other parent, if it's in a divorce
Yeah.
case, oh well, he or she is ruining my child. So when we say these things to ourselves, it puts a lot of undue pressure and then causes emotions, right?
Right.
Causes behavior and then it impacts how we respond to our child, right? So if I'm like, oh, I'm such a bad parent, why even bother anymore? Well, what might happen then? I'm going to feel what? Helpless. So you're talking about CBT, right? I do this, the triangle of
Yeah.
CBT, right?
Love
So
it.
you have like thoughts, feelings, and behavior. So if
Mhm.
my thought is, I'm such a bad parent, I've just damaged my children, then your feelings are going to be what? Like helplessness and um, giving up and withdrawing. And then what's your behavior going to be like? Well, maybe you're not going to talk to your children. Maybe you're going to isolate yourself from them. And then, of course, that affects them,
Right.
right?
Right.
But if we change our thoughts, as we know with CBT, and
Mhm.
we say like, okay, these are things I can't control, but I can model like stability and love. Um, if and I do have control over some of this. I have control over what I choose to present to my kids. And so it gives you that agency. And then how do you feel? You feel hopeful, you feel determined, maybe even more optimistic. And then how is that going to affect your behavior? You're going to want to connect with your child, show
Yeah.
them love, right? So you see how that just one thought, changing that thought really impacts ultimately how you're behaving and reacting to your child.
Yeah, I mean, that would be the CBT for parents in the middle of the storm too, because that is a hard place for divorce. I mean, I have never been, but I am the second wife. And
Okay.
so my three older bonus kids, I love calling them bonus children
That's
because I've been
cute.
their bonus mom for 30 years.
Oh, so cute.
Yeah, yeah. And then my son, I mean my son, my husband, I have our son together.
Mm,
But to me, like and then working in the Broward County school system with that, like CBT, I love too because it also aligns with my faith. Like there's all words in there about challenging the thoughts, challenging the thoughts. You have to
mm.
learn to challenge the thoughts, right? Sometimes I challenged authority and they didn't like it, but but like with CBT, because honestly, I have not had a conversation about CBT. I think it's like a
Yeah.
given in our field.
Yeah.
And you know what? A lot of people don't know that. I just trained
No, they
a
don't.
bunch of
Yeah.
executives. I trained a bunch of they hired me to train them. And it was like I took it, we have psychologies or, therapies, like we have this
Mhm.
vocabulary we all know. But when somebody never took Psychology 101, or they did and they forgot because that's not their calling or their place
Yeah.
or their learning, let's talk about CBT a little bit more because to me, like, I mean, you taught CBT to doctoral students, so you know your stuff. Me, I got it from my master and then I read my books. I'm not like certified or anything like that, but that's all I went. My internship for a whole year was in a CBT public school.
Yeah. Wow. That's
Yeah.
cool.
Yeah, it was. It was cool. I
Mm.
learned a lot. I learned a lot of what to do and I learned a lot of what not to do. So, cognitive behavioral therapy. Can you
Yeah.
explain it a little bit more?
Yeah, sure. So there's a simple way of explaining it, and then of course there's more complexities as you study it in a deeper way. But as I explained, the basics are a triangle, all right? Thoughts, feelings, and behavior.
Hmm.
And changing one, changes the whole outcome.
Right.
Um, Also, the thoughts that we have and that we develop within ourselves come from our childhood and how we were raised and the experiences that we've had. So we develop these core beliefs that override everything we do. And it's interesting when people, when you're in therapy, to peel the onion and figure out what those core beliefs are, because then they continue to show up in your life. So, for example, if your core belief is like, I'm not good enough, that's a very common one.
Yes.
Like, no matter what I do, like, I'm not good enough, right? That is going to show up in every relationship, in every interaction that you have in school, every task that you try to do, you're going to find that, oh, I'm not good enough, or I should be doing more. There's a lot of the
Oh,
shoulds, right? The
yes.
shoulds, yeah. So it's really helpful to understand what are those core beliefs,
Hmm.
and then how are they showing up in my life, and then really understanding the specific thoughts and what we just discussed, right?
Yeah.
Like, and changing them to be more adaptive, more hopeful, more optimistic.
Right.
And once you can do that, you really see a huge change in the way that you even interact with the world and the way people see you also.
Right. Yeah. I mean, that's how I usually start, honestly. Like, because back in the day, I'm not a psychologist. I don't have assessment. I mean, I do assessment, but I was in the public school system. I mean, like, or
Yeah,
community mental health, like
yeah,
most of us start out
yeah,
before we, move forward and learn more things. But I know cognitive distortions, right? Like, that is the
right.
list. And I'm going to put the PDF into the show notes because to me, this is the whole point of the show is to teach people not to become their own therapist, but not everybody can afford us,
Yeah,
Dr.
yeah,
Weiner. They can't. And
yeah,
and that's okay if they can't, but you can take initiative or agency over you, right? Over you as a person. So why not learn? Like what do you because I knew right away when you're like the shoulds, I'm like, yeah, that's a distortion, like one of the
that's
lists,
right.
right? And so we
Yes.
have lists of cognitive distortions that I give the client, my client, and I also do like the Myers-Briggs personality assessment. That's one of my go-tos because it's free.
Yeah, yeah.
And I'm not putting you in a label because some people are like, "Oh, I don't want to be labeled." And I'm like, guess what? Like we got to figure this stuff out. And these are certain love language assessment. That's another one that I utilize,
That's good
right?
too. Yeah,
Yeah, that's just because like human beings, like you coming to me, you're paying me some money to give you a service, right? So are you going to actually do the work that I give you, or you're just here to, like I
and it is
want to
hard
help
work.
you. It is
Yeah,
hard work. It is.
yeah,
It is. But the
yeah.
cognitive distortions, like what that, I mean, since you've worked with a lot of divorcing parents, right? And this is sort of where we were trying to go to. What are the three distortions you often hear from divorcing parents? And how can they reframe it?
That's a hard one. I mean, because it's
I know.
I think it's we're all different. I mean, people are all different, so it's hard to say like three common distortions, but one distortion is catastrophizing, right? Where you are always making things like bigger than they are. And I would try to ground that person. And first of all, it's recognizing that we're doing that, like, oh, it's all horrible. Like my life is over,
All or
like
nothing.
those all or nothing, right? And that's another one. Yes, yes. So I think that there's a lot of that
Mhm.
because when you're going through a divorce, you're going through like a major life change, and there's a lot that's not known about the
Yeah,
other side.
that's the
Like, how am I
fear.
going to come out of this on the other side?
It's scary.
So there's a lot of fear, right? And
Yeah.
then it becomes, you know, this is going to be horrible. Like this is going to be the worst, right? And so there is catastrophizing. There's all or nothing thinking. The shoulds. I should be doing this. I should be doing that. or I have to be a better parent. I have to calm down. I have to, you know, so it's also the way that we're speaking to ourselves and being kind to ourselves.
Yeah.
So I don't know if that answered your question. I gave you a few distortions,
Yeah.
and so I think that
It was with
those
the
are all the
divorcing
things.
parents because sometimes what I've heard, like when I would sit with the teenagers, right, and then they're coming, the teenagers got the anger, and what I found is that they either were the anger was coming outwards, so they're beating up other kids or teachers or whatever the situations because of the anger, or they were beating themselves in. So that's the cutters, the real super depressed, right? And then when I come find out, like, oh, the parents, like and here I want to be very gentle with this situation because I know I worked with parents too. I don't do family therapy anymore, and I
Mhm,
don't work with adolescents. I'm basically just with women now.
mhm.
But what I realized was like I wasn't trying to blame the parents. Some parents like come in already and they're, it's a very difficult. I mean, I don't know how you do it, girl, because that's very, very difficult caseloads, especially when it comes to divorce, because unless it's a very nice, like, who was it? Gwyneth Paltrow that did the uncoupling. Do you know what I'm talking
Right.
about?
They
With
had a lot of those things that collaborative,
right,
divorce,
right,
and yeah,
right. Well,
they're trying to
that's
make it more civil.
yes, right.
Yeah.
But that when the kid, it is, that all that anger and everything, and the parents are like, they never did that. I mean, that's another cognitive star,
Hmm.
they never. It is just, I don't know, like, how do you like really help the teenager? I guess that's because my
Yeah.
heart's been with the teenager in a situation like that. I mean, I've even seen parental alienation, and that, I mean,
Yeah.
Dr. Weiner, how do you deal with that stuff?
Yeah.
Honestly.
So the emotions, I think, first of all, educating parents and helping them understand that to not take things personally and understand that this anger or whatever the child is saying or how they're acting has to do with their emotional pain inside
Yeah.
and not being able to express it in a healthy way.
Right.
So sometimes that eases things because like let's say a child says like I hate you, I
Mm.
never want to see you again, you ruined my life, right?
That's
So
it.
which I'm sure we've heard of many times, right?
Yeah.
So and that hurts, that
Yeah.
really hurts parents,
Hmm.
right? And rightfully so, I can understand that. But if we understand that they're saying that because their life, this child's life, is being turned upside down, they're not sure of what is going to happen or what the outcome is going to be for them. And so out of fear and anger, how could you do this to me?
Yeah.
And often they don't even understand like the logistics of why the divorce happened, which they probably shouldn't in most cases understand the specifics, right? But because they don't know, they're just lashing out, right? And as you said, that could come in internalizing behaviors or externalizing behaviors. So helping the parents understand and also helping the child, validating the children that
That's it.
their feelings are important and you understand why they're feeling the way they're feeling. And also we can help them express their feelings in a different way and get them heard
Yeah.
rather than ignored or, you know, yeah, avoided by
Do you have
parents.
do you have like any kind of books or resources, or like do you give them actionable tools to take home with? Like, what do you do in your practice?
So I don't have, I read books all the time. I don't have any specific book
Mm.
about, divorce or anything, but I do think books in general are very helpful,
Yeah.
like especially for young children
Hmm.
and also narratives to help them understand like a social story, so to speak,
Okay.
like especially for kids on the spectrum, to
Yeah.
understand like, okay, my parents are divorced. I will have two homes. On
Mm.
Monday, Wednesday, Friday, I will be going to my mom's home. On Tuesday,
Right.
Thursday, and every other weekend, I will be going to my
Right.
dad's home. Um, I am going to decorate my room. Like just really writing like a very simple story,
Okay.
factual information for them to understand. And of course, this is depending on the level of functioning of the child and their age and developmental level as well.
Right.
But just helping them to kind of understand what's happening in a very calm way
Yeah.
is often very helpful. So,
So,
yeah.
I've seen as well when what parent refuses to accept the autism
Mhm.
diagnosis, and I've seen damage done with that
Yeah.
because the kid could have gotten the or received the help
Services. Yeah.
at a very young age, but the parent was in denial. And what how do you help that? Like, how do you
Yeah.
help a child caught in that dynamic? Because I mean, this is why the divorce happened. Like I'm thinking of some of the cases, right? It's like the parents have the child, and then by 5 years old, you're starting to see they're not functioning how, and one parent is gaslighting the other parent and going, no, you're crazy. No, he's going to be fine. He's going to be fine. He's going to be fine. And now he's a 14, 15-year-old who's not fine, who, the poor parent now is like, all right, I can't be with this man or woman anymore. And so, how do you help
Yeah.
a child caught in that?
Yeah, so I mean, I think, of course, there are ways to help the child, but I think I would focus on the parents
Mm,
also. I mean, of course, the child, I'll start with the child. You have to look at where they're functioning and kind of do your own assessment as a therapist as to where they're at. And very often in those situations, the expectations are maybe way higher than the child can deliver. And so often the child is disappointing the parent. And that takes a toll on the child because they feel like a failure. Then they have their core belief of I'm a failure or
yeah.
all those things. Um, and so it's really to build up the child and help the child know that they're doing okay and to help them rise to whatever occasion that they can and understand also again validate their feelings that they're not meeting their parents' expectations and how does that feel and really talking about that with them in terms of the parents everybody goes through their own process, even their own, I will say, like grieving process sometimes as to what their ideal was or what they thought that their child was going to be like. And understanding how that differs from the reality of what their child is like, and talking to parents about that.
Yeah.
And I try to even stay away from the label and just really stick with what is happening,
Yeah.
right? And also, what would happen to the parent? What would the parent think about themselves if they had a child on the spectrum? Which hopefully, hopefully they would think like my child is special, my child is unique, my child has a lot to offer the world, they're just different, these kinds of things. But a lot of parents don't think that way, and obviously there are a lot of struggles associated with kids on the spectrum. So, and it's very hard for parents that, often parents are feeling like a failure, like
Yeah.
I'm not doing the right thing as a parent. So it's validating the parents and the
Hmm.
fact that they are trying their best and understanding their early childhood also and expectations of themselves
Right.
and what does it mean that their child is this way or that way
Right.
because often it's like oh well maybe other people will view me
Exactly.
in a certain way
Yeah, and
um
that's the next question like I wanted to ask is like so many
yeah
parents they feel judged or shamed by schools, church communities, or even therapists or their doctors, right?
yeah
So how can they reclaim that confidence in their parenting voice when everyone else has an opinion?
yeah it's really hard. I mean, I'm not going to just say, oh, everything is roses and like
Yeah.
that would be a really bad. I think that it takes a lot of inner work for that, like a lot of meditation and mindfulness
Hmm.
to really understand what brings you peace.
Yeah.
What brings you happiness? And tune out those other voices because nobody knows what's good for us as well as we do,
That's
right?
right.
So I would just, advise people to focus on them and
Hmm.
focus on their child, what brings their child peace. And that's going to be very different and it's going to vary from child to child. It's going to vary from developmental level to developmental level, et cetera, et cetera. And just to meet their child where they're at and to meet themselves where they're at.
Yeah. And that's why they need well, first community, a healthy community, because sometimes we don't know that it's unhealthy until we get out of it and look at it and going, oh,
Right.
it's like becoming that curious observer of yourself
Yes.
without the shame and the guilt that our culture and society has been putting upon, different places. And you were talking about the othering earlier, which
Mhm.
which I mean is like when you don't know a specific say community or culture and you're looking at them, it's the fear that will rise up in you to either super be judgmental and like, oh, I hate them, or so fearful that you run from them, right? Into a place. That's what our brain has, that's what we developed in because that's how we're made is to protect ourselves. Anyway, sorry guys, my dog. Anyway, um, I just want to know, like, have you had a personal or professional moment that made you say, this is why I do this work?
Yeah, I mean, I've had many of them. I'm fortunate enough, and I love what I do so much. It's so rewarding because I do get parents who say to me, like, you actually see my child for who they
Oh,
are.
I love that.
And yeah, and it's you're not labeling him or her, you're not like telling me to fight with the situation. You're just kind of seeing him where he's at.
Yeah.
And I know that's like, as I'm saying it, I'm like, I know it sounds like pretty simple, but it's actually not because as you mentioned, like all the voices from outside and even from your inner self as to what should be happening and whatnot. And I'll just put in, this is why I love doing psychological evaluations
Hmm.
because it really helps to understand not only what the child is struggling with, but more so what their strengths are.
Mm.
So I really love to help parents like, be like, whoa, did you know that your child has like amazing visual spatial skills? Like, I bet you didn't know that. So really helping them to connect because when you're dealing with kids either on the spectrum or ADHD or extreme anxiety,
Hmm.
it's exhausting. It's very difficult. So and also, it can be a pattern of negativity. So, we want to instill that positivity and be able to see what they're doing that is amazing and that shines
Yeah.
through all the difficulty.
Well, let's talk a little about the psychological evaluations, right? The
Mhm.
evals, because I don't do them. I'm not a psychologist. So I always have to send people to you.
Yes.
Can we just explain it? Because some people really don't know. And I didn't have to study that to know that. I
Yeah.
just know just go to the psychologist because you need an eval. What
Right.
is that? What is a psychological evaluation? How long does it usually take? And how do I get one?
Okay, well, you get one. That's an easy one by calling us, and then we schedule the appointment. But I'll give you all the information. So there are many different kinds of psychological
Okay.
evaluations. It just depends on what the issues are and what we're looking for. So, in the case of understanding how a child is learning, or how they would benefit, or if they need any accommodations in school, such as extra time or being in a separate location or needing the words enlarged for whatever reason, books on tape, we used to call it a long time ago, but like,
Wait,
like
what's tape? No,
or
I'm just
tape,
kidding.
exactly. So, like hearing the books instead of reading, reading their directions for them,
Hmm.
things of that nature. So there's a whole host of accommodations that can be given to children based on their strengths and weaknesses, and what is found. And it is so amazing because once we do that and we figure that out, like what would benefit them, it's like a whole new person very often. They are like, oh, like I get it. Like I can be successful now. And you can only imagine how that impacts a person's self-esteem, yeah, and their life. So one type of evaluation is called a psychoeducational evaluation, where we do a cognitive assessment and we do testing, academic testing, so we understand what their skills are, and also understand how they're doing in the classroom, how they're doing at home, and how we can help them live a more successful life. So that's that. We also do evaluations for any emotional issues, if there are mood issues, behavioral issues, anxiety, depression, trauma. We help to kind of tease out what what are the main concerns and what are the behaviors that the person's having, and how do the behaviors impact, like how are they serving the person.
Right.
So for example, if a child is acting out, let's say in the morning, what class do they have in the morning? Math. Okay, well, maybe they don't like, maybe they feel that they don't do well in math and they can't do math. So they're choosing, instead of to express that, to have a meltdown every morning, right? So we kind of figure out like what are these behaviors? When are they occurring? Why are they happening? And how can we change things so that we don't have that occurring?
Yeah.
And again, we really, because most people, when I say, it's very rare that somebody just has one diagnosis. For example, like ADHD
Hmm.
often comes with other symptoms,
Right.
because that's how we adapt
Right.
to those symptoms, right? We try to overcompensate for our difficulties. So we figure, so then what seems like one thing, and what a parent might say, oh, my child has ADHD, that I've heard that many times, and even has gone so far as to put a child on stimulant medication, and then finds out like, oh, actually it's not the ADHD, it's an anxiety issue, or it's a
Right.
depression issue, or they're responding to some trauma that they had in their past, or so, and it just looks like ADHD
Hmm.
because the child is hyperactive, or
Right.
can't focus, right? But if you're anxious about something, you also have a hard time focusing.
Yeah.
So we really need to help them understand what is impacting the most, and then we can tailor the treatment based on that.
No, for sure. I mean, like that makes a lot of sense. And what Dr. Fox said last week, it's still ringing in my head because I'm like, I had
Mm.
no idea. Like you, you should have your psychological evaluation like every 3 years or the law or something
Yes.
like. And I was like,
Yes.
wait, what? I never. Like I said, I'm still learning. I'm going to learn until God takes me home. But it's like honestly, like that makes sense because we come in thinking these certain labels or diagnosis, but if you haven't gone through a thorough psychological evaluation, which how long does it take, honestly, to go through one?
So typically, I tell people it's about 2 to 3 sessions of about 2.5 to 3 hours each time.
Oh, so it's a real thorough
Oh yeah,
evaluation. So this is
yeah.
like you just mentioned like a 6 hours of are you like doing questions or is it like here put this puzzle together? Like
Yeah, so there's some of
oh,
that, and again, it depends on the age of the child, and we
hmm,
also work with adults as well.
okay, right.
So it depends on who the person is, adult, child, young child, but we have a variety of different testing materials to look at a variety of skills, including even memory development, um, fine motor functioning, speech and language we do as well.
Mhm.
So, receptive and expressive language, as well as the typical psych eval, which is, the cognitive, the social emotional, and the academic assessment. So
Okay.
we really do, I have to say, like very thorough evaluations. We have implemented, if somebody doesn't want the entire evaluation and they just want one question answered. For example, like, does my child meet the criteria for autism spectrum disorder, or does my child have ADHD? So we have a shorter evaluation for that, and
Okay.
it's more abbreviated,
Hmm.
but you don't get the whole, picture in
Right.
that. You would get just, information about what you're asking about.
Do you take into consideration the cultural aspect of things? Because that's one thing that I saw, honestly, as when I first started in the field, the lack of understanding of the different cultures that people come from. I mean, I'm not, even
Absolutely.
though I'm American, my
Yeah.
culture has a spirit, there was a spiritual aspect to things,
Yeah.
and then or other things happening, and then they were being diagnosed. I'm like, wait, what? No, like they don't understand you're Puerto Rican. Like, like, wait a minute, like, how is that?
Absolutely.
So, how do you deal with that?
It's very, very important to understand the culture. Extremely important because, as you said, symptoms can be misunderstood for other, psychopathology,
Yeah.
or I'm not even going to say symptoms, but like just behavior can be misunderstood for symptomatology. So I
Hmm.
was actually talking with somebody recently, and she's very spiritual, and she believes in, people who have passed, like sending messages and things. And so her child was saying like, "Oh, grandma, sent me a message," or something like that. And they, the school like thought that the child was like psychotic and hearing voices and things, which
Right.
was completely, completely false. It was just that the mom talks a lot about
Yeah, exactly.
the child's grandmother and those things, which is totally
Hmm.
fine and great. So we definitely have to know
Right.
what is going on culturally so we can understand the
Right.
child.
Yeah, I mean, so it's not the quick diagnosis because this is what I saw back in the day, right? Because I
Mhm.
mean, it was just a quick diagnosis and then the quick medication, and then it's like, wait a minute, there's more to the human being than those things. Like,
Oh
and
yeah.
I love, and that's why you're on the show, girl. I'm just telling you right now,
Thanks.
that is why you're on the show because I don't just let anybody come and talk to me. Like, I mean, I'll listen, but it's just
Yeah.
like, no, you understand that it's a complete a well-rounded, holistic approach to the
Yeah.
human being. It's not this just one way. And that's important, especially with psychology, right? And understanding, like, because it's a psychologist has a powerful influence on things. That's what I realize. I mean, I know there's a pecking order in our field, like,
Mhm.
psychiatry, psychology, and then us, LMFTs or LMSHCs or LCSWs or LPCs or whatever, because I'm talking to people all around the world now. Uh, and then you have the interns. And to me, like, I want an intern to understand, like, even though I said pecking order, it's your responsibility too to understand what Dr. Weiner is talking about in a way to help your client, or if you want to call them patients, your patients,
Mhm.
or the human being that you've been called to serve. The importance of being holistically minded and respecting, because I love that you kept saying, like, no, like, we have to validate the human in front of us, either the child, you talked about the child, and you talked about the parents. I mean, you probably have seen a lot, like, difficulty differently than I have because of being a forensic psychologist, because that to me, I'm like, whoa, that's big deal, that's law, that's legal stuff, right? Like
Yeah,
that,
yeah.
like your word is coming in as evidence. Woo.
Yeah. But I don't, I don't really think about it that that
Sorry.
closely.
No, she's gonna hang
I'm
up
like,
now
I'm
going,
like,
oh
oh, maybe
gosh.
I should think about that more. No, I'm just kidding. No, I mean, I think that it's important to be confident in your experience, in what you do, and I have a scope of practice, and I only practice in my scope of practice of what
That's
I
it.
feel confident speaking about. So,
Yeah.
there might be something else that comes up that I'm like, I am not an expert in this. I cannot speak to this. So I'm very careful about that. And the things that I do well, I do really, really well. And then
Yeah.
I don't really go outside of that box.
Right.
Um, But I have tried in my private practice to really make that box very big. So
Hmm.
it's sort of like a one-stop shop for mental health. We do so many things. We and provide so many services, individual, family, couples. We see children, adults, families. I love the family work that we do. Because like we'll have one clinician see parents and the other clinician see one child and another clinician see another
I
child.
love that.
And then we have supervision and talk all
Wow.
together, which is a
Wow.
really nice service. As I said, we do testing. We have groups that we're running. One group is called Pathways to Peace, which is a group for women. You said you see women. So women going through a divorce or a separation or breakup.
Really?
Yeah.
Okay. Is this online or in person?
So it's a hybrid. It's actually in Florida.
Okay.
Um,
Good
and
to
we
know.
have it also virtual. You can join virtually as well.
Is it where they're recently divorced or say someone like has been 5 years into divorce? I mean, like what do you mean by that?
It just means if they're struggling, it doesn't matter. We don't put a time period on it of like,
Okay.
when.
I think it's
It's
because
just,
I'm starting to think of like, oh my goodness, my client would be so great.
yeah,
Because,
send them on over.
all right, no, all
Yeah, it's
right,
really, so we don't put a limit on it. It's just people who are struggling to find their,
footing.
identity again
Yeah.
and figure themselves out after this experience, which is, of course, life changing.
Hmm.
Um, so just navigating that. And I've heard that it's really been so, so helpful to women who see other women who are in similar
Yes.
situations and being able to connect with them. So,
Right. The community part that I'm always talking about to find a healthy community that's moving forward with healthy tools or, like learning processes that are going to bridge a gap of health and wellness, not just sitting there and have a some people just get together and they stay in the circle of like complaining. I hate to say it
right.
that way, but
Right.
you know what I mean? And it's okay. I mean, if you're starting new, of course you're going to have to go in there. But if like 20 years later, you're still saying the same thing over and over and over, expecting different results, we all know the meaning of that.
Right. But actually, as part of this group, what we do, it's not just a group, like a process group, it's
Uh-huh.
also education. So we bring in professionals like attorneys, because I like attorneys,
Yeah.
and the people who can be helpful, like financial advisors, who can be really helpful to people, women in this that are going through this situation.
Oh my goodness, I love that. I
Yeah.
love that a lot. Like, okay, cool. Okay, so do you take insurance or no?
So for the groups, we don't take insurance, but it's really reasonable. It's $47 a group.
Oh,
Um,
okay.
so it's
And
really
can
reasonable.
can they hop on at any time? Like some groups you can just come in, or is it like, oh, here's week one, this is what we're doing. Week two, this is what we're doing. How's
No,
that work?
it's not a like a curriculum or anything like that. You can jump in anytime. The best thing to do is have a free consultation with Dr. Aisha Robinson. She's our clinician, she's a psychologist in Florida, Boca Raton, and she will have a free consultation with anyone about the group
Okay.
and kind of they can determine if they're a good fit for the group or not.
Wonderful. All right. Well, I think I could keep talking to you on and keep picking your brain and asking you some questions, but I know we both have probably clients or patients. I don't know. What do you
Yes.
call them? Clients or patients?
I think I call them patients. It's been like automatic now. I don't know. That's just what I've always called them from
No,
all the
no, it
years.
makes sense. It
But
makes sense. I mean, it is. Psychiatrists, of course, call them patients. I don't. Maybe they
yeah,
call them clients. I don't know. I think I've only had a couple of psychiatrists on, actually.
maybe it's because I do use somewhat of a medical model, like and really look
Yeah.
holistically, and so maybe that I don't know
Yeah. No.
unconsciously maybe that's why I call them
It's
patients.
what you know what? It's about the intention of your heart, Dr. Weiner,
Yeah.
honestly. And I can tell your intention is to help the human being that comes across your threshold. And that's a wonderful thing. And I'm so grateful that you came on the show. Is there anything you want to say to the listener before we hang up?
No, it's been a pleasure talking to you. Thank you for having me on the show. And if anybody needs our practice, I'm sure that you'll have the information you know, on the notes for the
Mm-hmm.
show.
Yeah.
And yeah, thank you.
Oh, yeah. Thank you. Thank you for coming on. And hey, listener, remember, to, please try your best to trust in the Lord and guard your heart and renew your mind. Have a great one. Bye. And now for the disclaimer to make sure you understand that you are responsible for you. The content provided on the Holistic Counselor podcast is for entertainment and informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified mental health provider with any questions you may have regarding a medical or mental condition. Never disregard professional medical advice or delay seeking it because of something you have heard on this podcast. The views expressed on this podcast are my personal opinions and do not represent the views of any professional organizations with which I am affiliated. Call your doctor, 911, or 988 immediately if you have a medical emergency. The Holistic Counselor podcast does not recommend or endorse any specific tests, physicians, products, procedures, opinions, or other information that may be mentioned on the podcast. Reliance on any information provided by the Holistic Counselor podcast, guests appearing on the podcast at the invitation of the Holistic Counselor podcast, or other listeners to the podcast is solely at your own risk. Confidentiality notice. If you engage with the Holistic Counselor podcast by commenting or posting and are a client, please be aware that you may be revealing information that could compromise your confidentiality. Please remember that disclosing your identity or personal details can be linked to your clinical material. As a therapist, I am bound by confidentiality and will not respond to any disclosures of this type on this podcast. I am committed to upholding the ethics and confidentiality of the therapeutic relationship, which extends to all forms of communication in accordance with the laws and professional guidelines that govern mental health professionals. I want you to know that your privacy is of utmost importance and you are responsible for protecting it when interacting on this platform or any other public forum. Thank you.